So continuing bacterial diseases, now we're going to talk about tetanus. Tetanus is caused by Clostridium tetani, which is gram-positive, and remember, as a Clostridium, that genus is endospore-forming and obligate anaerobe. They do not survive. If there is Clostridium on your skin, it's dead. It's not going to survive, okay? What is important in this disease? What causes the disease is not the presence of the bacterium. It's the presence of the neurotoxin, which is an exotoxin, produced by the bacterium. So the name of the toxin is tetanospasmin, and this toxin is released from the cells when they're shedding, dying. They enter the central nervous system, and they cause a blockage in the relaxation pathway to the muscles, causing muscle spasm. Let me just show you this picture. So this is what happens, right? You have a synaptic cleft here, and then the toxin is released from the blood. It goes into the motor neurons. It moves in what we call retrograde action because it moves in the opposite direction of the synapse, and it keeps moving up and inhibits the inhibitory neuron, which is this one right here. So then what happens? The one that is causing the excitation continues to excite the muscle, and the muscle doesn't stop the contraction. So you have a spasm, or what we call a tetanus, that is continuous. So it causes what we call rigid paralysis, okay? This disease is not contagious. So the bacteria are usually found in soil, dust, and they can enter the body through breaks in the skin. So for example, they say if you have a rusty nail, the pores in the rust in the metal can contain Clostridium tetani from the soil, and that can get deep into your skin, and that's when you can get the infection, because deep into the skin you have less oxygen, right? And also woods contaminated with dirt, feces, or saliva can cause tetanus. You see in regions where there's not a lot of sanitation, a lot of this also happened in the past, where little kids were like crawling on the floor, and then through the umbilical cord that still didn't fall, in little babies, not even crawling if you think about it, they would get contaminated through that area, because you know the umbilical cord is still there, and it's kind of like an open healing area, and they would get tetanus like that, okay? So anything that punctures the skin, like a nail or a needle, through burn, you can get tetanus. Crush injuries, because you have the metal that can get deep into your skin, and injuries with dead tissue. The dead tissue can easily get the bacteria that is present in some fomi. Incubation period for this disease is 10 days, and it's shorter if you have more bacteria present, okay? What else do I want to tell you here? Let's see. One of the symptoms of tetanus include locked jaw, which is like spasms and tetanus on the muscles of the jaw, and the person cannot close the mouth. It causes cramping, and there is this sudden involuntary muscle tightening, right, which are the spasms. Often happens in the stomach, and it's very painful when it happens, like in more serious cases all over the body. It can progress to trouble swallowing, and it includes also headache, fever, and this is how, if it gets complicated and you have that uncontrolled tightening of muscles, it can affect your vocal cords, which is called laryngospasm, and it can break bones because of that spasm. And there are other complications. Even pneumonia could be one and difficulty breathing because you can also block the diaphragm. And this is one picture that shows clearly what would be a very severe case of tetanus. Okay, let's move on to botulism. Also caused by Clostridium, in this case Clostridium botulinum. It's a gram-positive, spore-forming, obligate anaerobe, as any Clostridium like from this genus are. Clostridium is also present in soil, aquatic sediments, and canned foods. This is why I have this picture here. So if canned or jarred foods are not preserved, properly prepared, and preserved with nitrites, you can have growth of Clostridium botulinum. Why? Lack of oxygen. They do not mind the salty type of environment, so they overcome the growth of other bacteria because they are more resistant, because they form the endospores. So the endospores protect them from any drastic condition in that environment, the acidity of a pickle or the amount of salt, because they form that endospore. So that's one way of them resisting to a drastic condition that other bacteria will not, and take over that vehicle, right? Again here, what causes the disease is not the bacteria, is the intoxication promoted by the toxin that that bacterium produces. So the botulinum exotoxin is specific for stopping the the release of acetylcholine in the nerves. So it blocks, I think I have a picture of it here. It blocks, that's the toxin, it blocks the release of the vesicles with acetylcholine from the motor end plate, from the motor neuron to the muscle. So the muscle in this case is the opposite of tetanus. It does not contract. So here, instead of rigid, you call it flaccid paralysis. Okay? You are inhibiting the contraction. And in the tetanus, you were accelerating the contraction by inhibiting the inhibitor of the contraction. All right. There are two different types of exotoxin. One is the type A that is more common, present in canned foods, but there's also type B, which is mostly present in seafood. There is one problem, which is they can also grow in wounds, but this is less common. And the symptoms in the case of botulism start with weakness in muscles that control eye movement, face, mouth, and throat. So usually starts on the head, and then it would spread to neck, arms, torso, and legs. They can weaken the muscles involved in breathing, which is super critical, and that could lead to death. One other danger of Clostridium when it comes to ingestion is botulism in infants, because it's not proven that they came from the honey, but we know that honey has Clostridium botulinum. And in that case, infants don't have yet a proper immune system to get protection against that very small amount of toxins, and they can get intoxicated. So then that's what we call infant botulism. Like I said, wound botulism is rare. The infant can be associated with honey. You can also have iatrogenic botulism caused by an overdose of injected botulinum toxin. Remember the Botox that women usually put on their face to relax the wrinkles? An excess of that can cause iatrogenic botulism. Okay? Usually the diagnosis is confirmed by very specific laboratory tests, and that requires days to be completed. When it comes to the incidence, there is an average of 110 cases of botulism annually in the United States. And about 25% of these cases are foodborne. 70% of the cases are infant botulism. That's why it's highly recommended that you do not give honey to kids younger than 1 year old. This is a table that is just going to show you a summary of the bacterial diseases that we talked about that causes meningitis, and then later we're going to talk about the fungal and the protozoal diseases. So now we're going to move on to leprosy. And leprosy is caused by a mycobacterium, gram-positive acid-fast rod, Mycobacterium leprae. And this bacterium likes and has a tropism for peripheral nerves and skin cells. It survives macrophages and invades the myelin sheath. Okay? Mycobacterium, because of that mycolic acid around the cell wall, they're very resistant to macrophage digestion. After, they can be phagocytosed, but they don't get to be digested. Okay? And transmission this is one of those examples that I gave you of non-communicable disease. Leprosy is only transmitted after a very prolonged exposed contact with an infected person or inhalation of secretion, which you could think that may be really hard to happen, right? This bacteria grows really slow, so the disease doesn't happen quickly, but it can cause that nerve damage that results in crippling of hands and feet, paralysis, and blindness. So you have numbness of the affected area, muscle weakness or that paralysis, and the nerves get enlarged, mostly in the elbow and knee, where you can see some nodules forming there, and that's the enlargement of the peripheral nerves. The eye problems usually happen because facial nerves are affected. There are two forms of leprosy. The tuberculoid, which is the narrow one, where you see some type of discoloration of the skin. So it's more related to skin sensation. And then you have the progressive form, which is the lepromatous. The lepromatous leprosy is the one that looks really bad because it's more severe, and it causes disfiguring nodules all over the body, including hands and feet, like I said, and it looks like this. See, that's the lepromatous, and this is the tuberculoid. This disease is diagnosed with a skin biopsy or skin smear and blood test, and can be treated with antibiotics. Around 100 cases per year, mostly immigrants from endemic countries. It can also cause, I didn't say, loss of eyebrow and nose disfigurement. Okay, more sad things for you here. So now we're going to talk about the viral diseases of the nervous system. So one of the diseases is polio or poliomyelitis, caused by poliovirus. It's transmitted by the ingestion of water containing feces that contains the virus. It's also transmitted by person-to-person contact. The initial symptoms are sore throat and nausea, and majority of the cases is asymptomatic. The virus goes to the GI tract, travels to the lymph nodes, and then can travel to motor nerve cells. In that case, which is usually 1% of the cases, you can have paralysis. They kill the cells in the upper spinal cord, causing respiratory failure. And in that case, that's what leads to the death. You had patients in the past using what is called iron lung, which was a machine that they have to help these kids breathe, because they're 1% that got a very severe case of polio. So if you look closer in this picture, you guys have this PowerPoint, you're gonna see how a lot of these are kids. So important about, so these are two kid cases of polio that were severe and caused the paralysis. And there are vaccines to prevent this. So in countries where polio is still endemic or has outbreaks, which is the case for some countries still, I think Pakistan still has polio. So it's usually countries that are going to have a low sanitation progress, because in this case you can get water contaminated with the feces, right, from other people that have polio. So to contain this virus, there are two main vaccines, the Salk and the Sabin. The Salk is the one that in case of need would be used here in the United States, which is injected. It is a little less effective than the Sabin, which is a drop. It's an oral vaccine that they give a drop to the kid in the mouth. But this promotes lifelong immunity. There was a risk that was overcame associated with polio Sabin vaccine. So what happened is these viruses, because they were just attenuated, they make a mutation in the gene of the virus in the chromosome, so the virus are not really able to cause disease, and that's the attenuated vaccine. The thing is, there was a mutation that was somehow allowed to happen after vaccine was given in the digestive tract of some patients with one specific strain of the Sabin vaccine. And that mutation reversed the virus to a pathogenic form. And that virus was shedding in the feces. And it contaminated the community that was receiving those vaccines. That happened in the past. And that was a risk that was, posed in different communities. But then they figured out what was that strain that was causing that whole contamination of the soil, and they removed that strain. So when you hear, oh, the Sabin vaccine was causing death, it was that specific strain that got reactivated, and then they found a way to remove that. So Sabin vaccine nowadays, it's safe, even though we don't use it in the United States. Actually here, you only get polio vaccine if you are going to go to an endemic area. If you're going to travel to endemic areas like Asia and Africa, you may need a one-time booster shot before you travel. So 1 out of 4 people, which is 24% of the cases, will have flu-like symptoms. 1 of 4 people, of the ones that are infected, which is 25% of the cases, may have flu-like symptoms. The other 72% are going to be asymptomatic. And the paralysis that lead to permanent disability is just in 1%. About 2 to 10% of the people who have that paralysis cannot breathe, have breathing issues. Now let's talk about rabies. Rabies is caused by the virus belonging to the Lyssavirus genus, okay? And they're a single-strain RNA, easily develop mutants, so that's a problem with rabies. That's why dogs need to get vaccinated either every year or every 3 years, because there is a lot of mutation, okay? This disease is transmitted through the saliva of the animals, right? So the animal bites you, and that wound, which has contact with the saliva, is what makes you contract rabies. In the United States, most of the cases are related to wild animals. 5,000 animal rabies cases are reported annually to the CDC, and more than 90% of those cases occur in wildlife. So when you think about dogs here, because there is a very strict surveillance system, we don't see a lot of rabies in dogs. What makes this disease spread is the fact that the animal gets really raged and nervous because it affects their nervous system, and they have that tendency to snap and bite, and that will cause the disease to pass and spread from animal to animal. There are cases, so in the United States, animals that usually have this are not just bats, but also raccoons, skunks, and foxes. Okay? Around the world where the rabies is not the one, is not so controlled in pets, it is more transmitted by dogs. Okay? In the United States, we went from 100 cases annually in the 1900s to between 1 or 2 cases per year since 1960. So we don't have a lot of rabies here. It's very rare, but it's because of this control and because usually people are able to keep a distance from wilderness, right? That's another pretty bad. That is one of the transmitters. Other than the furious rabies that I was describing to you, there is the paralytic rabies that you can see that usually in cats, and the animal is just stop and gets like very little excitation. It's like very still. That's another way that rabies causes symptoms occur. The average incubation period is between 30 and 50 days. Another symptom that is common is hydrophobia. Meaning what? These spasms that happen in the pharynx and in the mouth enable the animal to swallow. So it accumulates the saliva where the virus is present in the mouth, and then in the bite, it's super easy to transmit. This is just showing you how the virus, after the bite, can get through your peripheral nerves, and it's going to travel to your central nervous system and cause this fatal encephalitis. As treatment, there is what is called post-exposure prophylaxis, which is the individual that got bit by an animal, let's say that you may suspect that has rabies, he's going to receive a dose of immunoglobulin or human rabies immunoglobulin, HRIG, plus rabies vaccine. Even though it's already, there is a suspicion of, or there is a confirmation of the person being infected. So you can get immunoglobulin and vaccine after the exposure. Okay, and that's very effective. And usually you have to follow up with boosts of the vaccine on days 3, 7, and 14. The distribution in the United States is in animals like raccoons in the East Coast, in the central part more skunks, in Alaska you have foxes. So depending on where you are, there are more of one type of animal that will have rabies. And if you see the number of cases, dogs and cats are a lot less than other wild animals. Okay, I will see you in the next video where we're going to talk about the protozoan diseases and prions. Bye bye.